my name is Zach. I'll be your nurse today. Could you please state your name and date of birth for me? Okay, and do you have any allergies? Alright, great. So today we're going to be doing a nasogastric sectioning, hopefully to help you stop vomiting and get you ready for surgery. Just put these gloves on real quick. Alright, I'm just going to raise you up to a working height. Get my table set up higher here. Alright. So before we get started, I'm just going to inspect your abdomen. It'd be okay if I could pull your gown up. So first I'm just going to look for any distension or anything like that. Are you in any pain? No? Okay. Now I'm going to listen to all four quadrants of the abdominal area. Bowel sounds sound normal, 5 to 35 sounds per quadrant a minute. Okay, now I'm just going to palpate. Let me know if you feel any tenderness. Alright, I'm going to raise you up to a sitting position here. Approximately about 45 degrees. Alright, so I have all my supplies set up over here. Got my tape. Lay my blue pad down. Go ahead and cover the patient back up. And give them, okay, I have forgot my emesis basin, but I would place that right here with a cup and a straw, just to allow the patient to have something to spit into, and also hold the cup if they need something to drink. Alright, so I'm going to get this section ready to go. And get the tube in place here. So for the tube, I'm going to measure from the tip of the tube. The tip of the tube will be at the ear and to the mouth, and then from there we're going to measure to the xiphoid process, which is the soft spot at the end of the patient's sternum, and that sits at about 45. So now I'm going to mark 45 with a piece of tape, so I don't go any further than that. Okay, and now I'm going to grab some water-soluble lubricant and lubricate the tip of the tube. I'm going to look in the patient's nostrils to see if either one looks preferable or more easy to pass this tube through. Looks like the patient's right nostril is. So I'm going to begin sticking this in, and while I pass the tube through, I'm going to have the patient flex their head back towards the pillow to straighten out that passageway, so the tube will pass in a little quicker or easier. And once it gets past the measured amount that I measured from the ear to their nostril, I'm now getting to their pharynx, so I'm going to have them tilt their head back and put their chin to their chest, and I'm going to have them take drinks, take little sips of water so that they swallow, and them swallowing will help the tube pass through. So once that gets all the way down to 45, which would be about right here, go ahead and take this stuff away. Make sure the patient isn't in any pain or anything. If they were, we would want to stop the procedure and maybe try again later. So after the tube is in place, we're going to tape it in place. All right, tube is taped in place. Now I'm going to take my ruler here and measure the length of tube that is outside of the patient's body. Looks like about 21 inches. That's going to go into my documentation.
We as nurses don't approach it that way, but your director,
Alright, so before we begin the sectioning, I'm going to take a syringe out here. And I'm going to take out a little bit of the stomach contents. I'm going to take my pH strip and put a little bit of the stomach contents on the pH strip, wait 30 seconds to see what the pH is, and the contents of the stomach should be anywhere between 3.5 and 5.5 on the pH scale, which I have. Right here, I would compare the color. Okay, and the range did fall in between 3.5 and 5.5, so we are in the stomach. Now I'm going to take all the remaining stomach contents that I have in the syringe and go ahead and put it back into the patient's stomach. All right. So now I'm going to get ready for the irrigation, or I'm sorry, the sectioning. So I would go over and turn the sectioning on intermittent, and before I start sectioning, I'm going to aspirate or get a little bit of this irrigation fluid in and irrigate about 30 mil. Wrong tube. I'm going to irrigate 30 milliliters of fluid to irrigate the nasogastric tube. Now I will hook up the suction, and it is on low, so going to have to grab another piece of tape, or actually a safety pin. I'd like to have a safety pin handy, and go ahead and pin this to the patient's gown right here. Go ahead and clean my area up. Is there anything else I can do for you? All right. So before I leave, I'm just going to inspect the abdominal area again. Make sure there's no major differences in the sound and the look. We're still making sure there's no distension or anything, and palpating, making sure nothing's tender, and it's not. Grab the patient's call light, put it in hand, and I will lower them back down for safety. All right, just let us know if you need anything.